You reach into the treat drawer, and there it is, the Rawhide Chew, the thing that's been keeping dogs happy and busy for as long as you can remember, sold in every pet store, every supermarket, often marketed for clean teeth and long, peaceful afternoons. Your old dog's eyes light up the second you pick it up. And I'm going to ask you to put it back down. Because for a senior dog especially, that familiar, harmless-looking chew is one of the most common ways I see a quiet afternoon turn into an emergency surgery. I'm Dr. Ryan Mercer. In 15 years of practice, I have stood in too many surgical suites pulling a wad of swollen rawhide out of an older dog's intestine while a heartbroken owner sat in the waiting room asking how a treat could do this. They had no idea. Nobody told them. So let me be the one who tells you, before it's your dog, on that table. Let's start with what rawhide actually is, because most people have never thought about it. It's not food, it's the inner layer of cow or horse hide, cleaned, processed, and pressed into those knots and sticks. It's meant to be chewed, not eaten, and that's the whole problem because a determined dog doesn't read the instructions. He chews, and as he does, the rawhide softens and turns slippery, and then he swallows chunks of it. Here's what can happen next, and I want you to really hear this. A piece of swallowed rawhide can lodge in the throat and cause choking right there in your living room. Or it gets down into the stomach and intestines where it swells and gets stuck and creates a blockage. A gastrointestinal obstruction is not a wait-and-see problem. It stops food and water from passing. It makes a dog desperately sick. And very often the only way to fix it is surgery to physically remove the piece. That's the part owners never see coming, a treat that ends in an operation. And it isn't only the choking and the blockage. Rawhide can carry bacterial contamination, things like salmonella, which is a risk to your dog and to the people in your house handling it. And during manufacturing, hides are often treated with cleaning and processing chemicals that you really don't want your dog slowly ingesting over months and years. This is exactly why most veterinarians no longer recommend traditional rawhide as a first choice chew for any dog. And I want to take apart the one excuse that keeps these in so many homes, because it's the reason owners feel good about handing them over. The marketing? Rawhide is often sold with promises about cleaning your dog's teeth, and that claim does a lot of heavy lifting. Here's the honest truth. The small amount of surface scraping a dog might get from gnawing rawhide doesn't come close to outweighing the choking, blockage, and contamination risks. And it is not real dental care. If you want to actually protect your senior dog's teeth, the things that work are regular brushing, vet-approved dental chews designed and tested for the job, and professional cleanings when your vet recommends them. A risky chew dressed up as oral hygiene is still a risky chew. Don't let a label on a package make a medical decision for your dog. But stay with me, because here's why I single it out for your senior dog specifically. The risks I just described don't stay the same as a dog ages. They get worse. Think about your older dog's mouth. After years of use, those teeth are often worn down. Some may be cracked or loose, the gums more fragile. A chew that a young dog could manage becomes a real hazard. Think about digestion. An older dog's gut tends to move more slowly, which means a swallowed chunk has more time to sit, swell, and cause trouble. And think about the part that keeps me up at night. If that blockage does happen and surgery becomes necessary, an older dog is a far riskier surgical patient. Senior dogs are the ones most likely to have a heart condition, kidney disease, or other issues lurking in the background, and every one of those makes anesthesia and surgery more dangerous. So the same accident that a young, healthy dog might survive easily can become genuinely life-threatening for a gray-muzzled one. The treat didn't get more dangerous by accident. Your dog got more vulnerable. Now, before you go reaching for an alternative, I have to widen this warning, because rawhide isn't the only offender in that drawer. The very hard chews that people reach for instead, real bones, whether cooked or raw, antlers, and cow hooves, come with their own serious problem. They're hard enough to fracture teeth. Cracked and broken teeth are one of the most common reasons dogs end up in my exam room, and they're painful. And they often lead to infection and abscesses under the gum. No veterinary dental specialist I know will sign off on letting a dog gnaw an antler. So if your plan was to swap the rawhide for a nice hard bone, I have to stop you there too. For an old mouth, that's trading one problem for another. Let me pause because I know how this feels. You're sitting there thinking, I've been giving these for years and my dog was fine. And maybe he was. Plenty of dogs chew rawhide and never have a crisis. But here's how I want you to think about it. This isn't about whether it always goes wrong. It's about the fact that when it does go wrong, in an older dog, it can go very wrong very fast, and there's a safer path that costs you nothing to take. Why roll those dice with the years you have left together? So what can you actually give instead? This is where I want you to talk to your own vet because the right chew depends on your specific dog, his size, his teeth, his health, how aggressively he chews. But the general principles are simple. Look for chews that are genuinely digestible, that break down if swallowed instead of swelling and lodging. Look for something appropriately sized, too big to be gulped whole. And there's a good rule of thumb for hardness, the kind any vet will tell you. If you can't make a dent in it with your fingernail, or you wouldn't want to be hit in the knee with it, it's too hard for your dog's teeth. Soft enough to have some give, big enough not to swallow, digestible enough to pass safely, and always given with supervision. A chew is not a babysitter, especially for a senior. And here's the line I'll never cross because it's the whole point of this channel. I can tell you, in general, what tends to be risky and what tends to be safer. I cannot examine your dog's mouth through a screen and I don't know his medical history. So before you settle on a new chew, have your vet take a look at those teeth at the next visit and tell you what's actually safe for him. 2 minutes of their time can save you a midnight emergency. Now, what if your dog has already had rawhide today, this week, and now you're worried? Here's what to watch for, and please take it seriously. If your dog is gagging, pawing at the mouth, or struggling to breathe, that's a choking emergency. Go now. In the hours and days after, watch for repeated vomiting, refusing food, a painful or bloated belly, straining with nothing coming out, or unusual lethargy. Those can be the signs of a blockage forming, and that is a same-day call to your vet, not a wait until morning. Catching an obstruction early before the gut is damaged makes an enormous difference in how it ends. So here's your simple plan for tonight. Go to the treat drawer and actually look at what's in there. Set aside the rawhide, the cooked bones, the antlers, the hooves. You don't have to leave your dog with nothing. You just have to choose better and check with your vet on what fits your dog. And if your old friend gives you that hopeful look, remember that what he's really asking for is your attention, a little time, a gentle hand, a safe chew, a food puzzle, a slow walk, a few minutes of you. Those satisfy him just as deeply, without the risk. Let me leave you with this. Loving an older dog means protecting him from the things he doesn't understand are dangerous, even when he wants them, even when he's wanted them his whole life. He trusts you completely. He'll happily take whatever you hand him. That trust is exactly why it's on us to choose carefully. You came here tonight to do right by him, and you just did. That gray muzzle has good years left, and you're making sure a treat isn't what takes them away. If this made you look at that treat drawer differently, stay with me, because keeping an old dog safe is mostly about questioning the things we've always assumed were fine.